You've been told herbal medicine is alternative, but what if I told you some of the most trusted doctors actually keep herbal remedies tucked away in their cabinets, using them for themselves and their families? In today's video, I'm going to reveal 10 herbal remedies that many doctors quietly rely on, even if they rarely mention them in public. Some of these herbs are so powerful they're used in hospital settings, but others, they're right in your kitchen and you probably had no idea. Let's dive into these doctor-approved herbal secrets before they disappear from mainstream conversation. Starting with number 10, ginger, the gut hero. Now, this is one of the most ancient and respected. Doctors, especially those in the ER and in surgical units, they often recommend using ginger for things like nausea, motion sickness, and post-operative discomfort. It's gentle, it's effective, and the studies show that it works just as well, if not better, than prescription anti-nausea meds without any of the side effects. You can try it as ginger tea, you can chew it raw for the brave souls, of course, and you can add it to smoothies or broths. Number 9 on the list is ashwagandha, the stress shield. Now, you'd be surprised how many functional medicine doctors take ashwagandha daily, but rarely mention it to their patients. This adaptogen herb supports the adrenal glands, it regulates cholesterol, and it helps with burnout, insomnia, and mood swings. It's also popular among physicians under high levels of stress who want to stay sharp without stimulants. The forms you can use it is as capsules or powder, and also include it in your bedtime golden milk blends. Number 8 on the list is peppermint oil, the headache whisperer. Now, not all headaches need Panadol or ibuprofen. Doctors who specialize in integrative care use peppermint essential oil applied to the temples or the back of the neck to help with soothing things like tension headaches. It cools, it relaxes tight muscles, and it increases blood flow. You can also combine it with lavender oil for an even strong relaxing effect. Number 7 on the list is mullein, the lung cleanser. Mullein is becoming a quiet favorite among respiratory specialists in herbal circles. It helps to clear up mucus, soothes the lungs, and supports recovery from chronic cough, asthma, or bronchitis. And doctors rarely prescribe it, but many personally drink it during the flu season. And I personally harvest and dry my own mullein. It is a must-have in your home apothecary. Let's talk about number 6, which is not really my favorite, but it has amazing benefits. And we are talking about licorice root, the gut guardian. Now, it's used in traditional Chinese and Ayurvedic medicine and now recognized in integrative GI clinics. Licorice root helps to protect the stomach lining. And doctors who suffer from acid reflux or IBS or even ulcers often use DGL to coat and to repair the gut, and this is a form of licorice, and you need to avoid it if you have high blood pressure unless you are using the DGL version. Next up, number 5 on the list is valerian root, the natural sedative. And forget over-the-counter sleeping pills. They have so many side effects. Valerian is a mild sedative herb that some neurologists use for restless sleep, anxiety, or panic episodes. Unlike melatonin, it actually does not disturb your natural hormone cycle. It pairs well with lemon balm and passion fruit for a deep holistic rest. Number 4 on the list is Arnica, the secret bruise fighter, and this is my ultimate all-time favorite in the herbal first aid kit. You can use it during pre or post-operative surgery. In some European hospitals, they also use it. And Arnica also helps with things like reducing bruising, inflammation, as well as pain. And many surgeons recommend Arnica cream for fast recovery, but rarely disclose they use it too. Topical use only, never ever ingest unless it is a homeopathic form. And I always keep Arnica cream in my natural first aid kit. I've used it multiple times as well with great results. Number 3 on the list is also another one of my favorites. It's elderberry, the natural immune booster. And this is amazing to be used during the peak cold and flu season. Pediatricians also and family doctors reach for elderberry syrup, especially those with children. And also, clinical studies show that elderberry can reduce the duration of viral infections by up to 4 days. It tastes sweet, it supports the immunity, and it's also safe for kids. You could also check the dosages they differ from brand to brand. I do it at home myself, just bringing the dried elderberries and combining it with other immune boosting herbs like echinacea, like peppermint, thyme, oregano, a little bit of calendula as well. Boil it in for about 15 to 20 minutes, and then after that, strain it. Once it's warm, add in the honey, and you can also try it to making in gummies by adding a little bit of gelatin, and you can also make elderberry syrup or homemade tonics that way. Number 2 on the list is black seed oil, the Middle Eastern wonderful oil that we all know the benefits for. It is known as the cure for everything but death. In ancient text, black seed oil is gaining popularity with progressive doctors as well, and it supports things like inflammation, blood sugar, immunity, hair growth, and even respiratory health. You'll hear whispers of doctors talking about a spoonful a day, but it's rarely recommended officially. Now, the tip here is always look for cold pressed organic oil, and you can even mix it with honey for a powerful daily ritual. And number 1 on the list, we have turmeric with black pepper, the inflammation buster. And this one might not surprise you, but here's the real secret. Turmeric, when you combine it with black pepper, becomes up to 2,000% more bioavailable. And that's the form many orthopedic and oncological doctors take for their joints, for their inflammation, and even for their kidney support. And you'll find it in capsules with piperine, in golden milk, in homemade turmeric honey paste as well. It is one of the most well-researched herbs in modern medicine, and for a good reason. Now, as a bonus tip here, one herb that is powerful but dangerous with medications is St. John's wort. It interacts with antidepressants, it interacts with birth control as well as other meds. So if you do decide to use St. John's wort for anxiety, for any of that kind of emotional help as well, always do your research before mixing herbs with prescriptions, and consult your doctor before using any of these herbs in medicinal form as well. So now that you know, herbs are not just for hippies and herbalists. Even doctors rely on them quietly because they work. If you're building your natural medicine cabinet, start with these 10. Like this video if you learned something new, share it with a friend who still thinks herbs don't work, and subscribe to That Holistic Mom for more videos such as these. And also drop a comment below, which of these herbs do you really already use, or which one will you try next? I'll see you in the next one. Take care and have a great day. All the best.